Hi, my name is Sruthi Raguveer, and I'm excited to tell you a little bit about my past and current research. So first, I'd like to tell you a little bit about my undergraduate research project, which is titled Integrin-Binding Peptides for Targeted Drug Delivery to Pediatric Solid Tumors. So for this project, I worked with a peptide drug conjugate. This peptide, which I'll refer to as PIP, was previously engineered to selectively bind to integrin receptors, such as these 5 listed here. Integrin receptors are overexpressed on a number of cancer cell lines, which means they're a promising target for cancer therapy. With this peptide, I then conjugated it to a cytotoxic drug, in this case MMAE, which is an anti-neoplastic agent often used in antibody drug conjugates. I conjugated it with a cleavable linker here, which is Val-Cit. The goal of my project was then to test this peptide conjugate in multiple cancer cell lines to test for efficacy. The first step of my project was using flow cytometry to quantify the number of integrin receptors on these different cell lines to see if we could expect to see efficacy using an integrin targeting peptide. As you can see here, the levels of integrins are variable among the different cell lines. However, in all of them, they're quite high, showing that we would be able, hopefully, to see some efficacy. I then went on to test these peptide drug conjugates in these cell lines. Here is some representative data. And so this is a time lapse taken from IncuSite, which is a live cell imaging platform, over a period of 3 days with treatment of these drugs or drug conjugates. So in the top left, you can see the peptide drug conjugate PIP-MMAE and how it inhibits cell proliferation and leads to cytotoxicity, shown here with the green dye, over time. And this is especially true in comparison to the untreated control you can see on the top right, and the scramble MME on the top bottom, which continue to grow and do not see cytotoxicity or inhibited proliferation. And the scramble MME in this case is a peptide drug conjugate that cannot bind to integrins. So overall, this showed how we were able to see some efficacy with the peptide drug conjugate, however, only at higher concentrations. With that, I'd like to thank my undergraduate mentors and PIs, Carolyn Bertuzzi and Jennifer Cochran, and my graduate student mentors at the time, Caitlin and Amanda. After graduating from Stanford, I moved on into the industry and worked on 2 different biotechnology startups, Soteria Biotherapeutics and Epibiologics, which are both startups hoping to develop protein therapeutics for cancer. And at both these startups, I worked on the protein science side, doing things like protein engineering and antibody expression. This year, I've decided to go back to graduate school, and I'm now a first-year PhD student at UCSF in the Chemistry and Chemical Biology program. And I'm currently doing rotations. So far, I've worked with Professor Jim Wells and Ashish Manglik, working on things like protein engineering and structural biology. And I'm excited to continue in my graduate career. And with that, I'd really like to thank the Arts Foundation for all their support as I begin my graduate career. And thank you so much for listening.